Oh, good morning. I'm John Morris, and I'm the consultant looking after your husband, Mrs. Jones. This is Jennifer. She's one of the staff nurses.
Hello. Good morning. Good morning. Good morning.
Can I just start by checking what happened with you?
Yes. I just woke up this morning, and my husband was making these strange grunting noises, and he couldn't talk to me. And then when he tried to move, only one side worked. So I panicked, ran downstairs, called for an ambulance. The ambulance came and he was rushed straight here.
Well, must have been pretty frightening.
Oh, it was absolutely horrible.
Okay.
Absolutely horrible, yes.
And can I check, does he normally keep pretty well?
He does. He only takes pills for his blood pressure, that's all.
Okay, so you're pretty fit normally then?
Yeah, it's pretty fit, yes.
And can I also check, has anybody here told you anything about what's happened, any of the nurses or doctors?
Yes. Oh dear me, I'm sorry. Yes, the doctor said that he'd had a kind of collapse. He had a collapse, and it might be due to a stroke or a seizure or a brain tumour, and that you had to do more. Oh, sorry. You had to do more tests to see what was going on. I'm really very scared about this.
Okay. Well, as you know, he's had the brain scan, okay, and I've looked at it, so I can tell you some more details about what's going on, okay. Now, what the brain scan shows is a stroke.
Yes,
okay.
yes, right. Yeah.
Now a stroke happens when an artery is blocked,
right.
So the brain doesn't get blood going up to it, okay.
Yes.
Looking at the brain scan, I'm a bit worried about the brain scan because it shows quite a large stroke. It's got a large area of brain that's been damaged.
So that's bad? That's bad, is it?
Essentially, it could be bad, yes.
Will it get better, do you think?
Difficult to predict exactly what will happen with him. He's got quite a lot of swelling on the brain at the moment, okay, and I'm worried that the swelling may get worse.
Does that mean he might die?
Yes, it does mean he might die.
Oh dear.
Okay. Now, I can't say 100% what will happen, okay, but that is one of the things that may happen. Okay. What we want to do is bring him up to our ward, which is the stroke ward, where the stroke specialists can look after him. And one of the reasons we want to keep a very close eye on him is that if the swelling on his brain gets worse, we can think about doing an operation.
What for?
Well, if you have swelling in the brain, that can put pressure on the rest of the brain.
Right.
Okay? And you can sometimes do an operation that takes away part of the skull of the patient, so the skull bone on the side of the head, and that means that the pressure can go out the way rather than pressing back down onto the brain.
Is that a big operation?
It is a large operation, but I suppose looking at the other way, he's had a large stroke. You've seen him already. You know he's
yes, I know.
pretty incapacitated by the stroke. Now, if we do an operation, we have to think very, very carefully about whether we do the operation or not, because the operation itself is large and can stop patients dying. But if you have the operation, you can sometimes be left not able to do much after the operation.
What do you mean by that?
Well, I mean that even if he has the operation, he may not be able to walk, he may not be able to talk, he may not be able to dress himself or go to the toilet himself, so he might be left quite dependent on other people.
But that might be worse than death for him.
Possibly, and everybody's different, and we need to treat patients as individuals. So for some people that might be worse than death, for other people not. So what we need to do as a team, when I say we, I mean us and you and the nurses and everybody else, is work out what he would want us to do, because he obviously can't tell us at the moment.
Is there a chance that he may recover after this operation?
There is a chance he may recover after the operation. There's also a chance he may not need the operation, okay, which is why we want to keep a very close eye on him.
I understand.
At the moment.
Yes, yes. I don't think that he would want to die. I think that he would probably say, if he could talk, that he would want you to do your best for him.
Okay.
Yeah.
Well, I think that's very, very useful for us to know. Okay. Now, we've got a critical time period of the next 24, 48 hours, and that's the time period that we'll need to do an operation if
Right.
we're going to need one.
Yes,
Okay.
I understand, yes.
Now, we've obviously talked about quite a lot there. Is there anything else you would like to mention?
No, it's all just so overwhelming. But you've actually been very clear. I don't think there are any questions at the moment, but can I speak to you again if in the future if I think of anything else?
We are always here. There's always
Right.
a doctor and nurses who can talk to you about anything.
Well, that would be helpful.
Do you have any family at all?
Yes,
or-
yes. I don't really know how I'm going to tell the children. Will they be able to see him, do you think?
Well, we don't have hard and fast rules, and every family is different, and I suppose it depends on how old the children are and what they can understand.
Yes.
In general, every family is different, so different children
Yes.
take on different amounts of information. But if you, as a family, feel that it's right for them to come in, then of course we can let that happen
Yes.
and make sure that that happens.
Thank you. I mean, they know, of course, that he is very ill, but I would like to talk to them first, and then I suppose if there are any questions, we can ask you later.
Of
can't
course,
we? Yes.
we're always here. Okay.
Good. Thank you very much.
Okay.